Kidney stones, their causes, and their treatment. These are known as kidney stones. As a group of elements that combine in the kidneys to form a mass of crystals that may be smooth or rough in texture, it is worth noting that these stones range in size, may be very small in size of grains of sand, and may be as large as a peas, and in some cases may be as large as a golf ball, and these stones may move through the urinary tract leading to pain when they cross the urethra, and in cases where these crystals are large in size, it may lead to blockage of the urethra and feeling of severe pain, and some of these cases may require medical intervention to help get rid of gravel. It should be noted that there are many elements responsible for the formation of gravel such as calcium and uric acid, and in normal situation these elements are eliminated in the urine, but if the proportion of these elements exceeds their normal rates or the rate of urination is reduced due to not eating enough water daily, this may lead to the collection of these elements and their deposit in kidneys. Kidney stones are a common health problem, as a 2010 study at Wake Forest University School of Medicine, Indiana, North Carolina showed that rates of kidney stones are constantly rising around the world among women and men of different age groups, and in all different ethnic variations, and may be mainly due to changes in diet, or from rising temperatures around the world and global warming. Symptoms of kidney stones. Symptoms of kidney stones do not appear in many cases, except in cases where kidney stones move, or if the stones move to the ureter, and the symptoms that the infected person may experience can be mentioned as follows. Severe pain in the back and lower side of the rib cage, ribs from the affected kidney side, extending to the lower abdomen and thigh. Variable pain in severity comes in the form of intermittent waves. Pain when urinating. Nausea and vomiting. The frequent need to urinate, increasing the number of times urinating than normal. Small amounts of urine come out when urinating. Change the color of urine to brown, red, or pink. Note urine is accompanied by an unpleasant smell, a sour or cloudy appearance. Suffer from fever and chills in case of infection. Kidney stones are found to be four major types of stones that may form in the kidneys, and the identification of the type of gravel suffered by the infected person helps to determine the cause of their formation and methods of prevention of the formation of new stones. And here is a statement of the main types of kidney stones. There are several types of calcium stones, but the most common calcium oxalate, calcium grit is the most common type of kidney stones, and in fact oxalate is found within many foods naturally such as fruits, vegetables, and nuts. It should be noted that some health problems such as metabolic disorders, high doses of vitamin D, surgery of infectious bypass and some dietary factors may lead to increased concentration of calcium and oxalate, which in turn may lead to increased risk of infection with this kind of kidney stones. Struvite stones. This type of gravel is formed by some types of urinary tract infections, as some bacteria produce a large amount of ammonia or ammonia. This increases its concentration in the urine and forms this type of gravel, and this type of kidney stones is characterized by the speed of its formation and increased in size. Uric acid grit. Uric acid stones are formed from uric acid only, or may also be accompanied by calcium. The risk of this type of gravel may increase in some cases such as high pH, dehydration, or gout. Cysteine grit. This type of kidney stones is formed by a high ratio of cysteine compound in urine, a naturally produced chemical in the body, and this type of kidney stones occurs very rarely in people with a genetic disorder that affects the ratio of cysteine compound in the urine. Causes of kidney stones. Kidney stones in most cases are not caused by one of the specific causes, but rather as the result of the combination of a number of different risk factors, and as mentioned earlier for the mechanism of forming stones, which is to increase the proportion of some crystallizable elements in the urine, such as calcium, uric acid, and oxalate compared to the proportion of fluids that dissolve these elements. Risk factors. There are many factors that increase the risk of kidney stones, some of which can be mentioned as follows. Diet. Eating sodium-rich diets increases the percentage of calcium released through the kidneys, which in turn increases the risk of gravel formation, and eating foods that contain sugar and protein-rich foods increases the risk of some other types of kidney stones, so be careful to eat a healthy and balanced diet. Dehydration. Dehydration is one of the most common factors that increase the risk of kidney stones, so be careful to drink enough water on a daily basis. Health history. The risk of kidney stones increases if there is a personal or family history prior to kidney stones. Metabolic disorders. There's a bunch of metabolic disorders which increases the risk of kidney stones, such as hyperthyroidism and renal prophetic acidity. Obesity. The risk of kidney stones form increases in case of obesity, increased waist circumference, or high BMI. Digestive disorders. Some digestive disorders may affect the ability to absorb water, electrolytes, and calcium, leading to an increased risk of kidney stones, including inflammatory bowel disease, ulcerative colitis, and Crohn's disease. Other factors. There are a number of other factors that may increase the risk of kidney stones, including some types of urinary tract infections, some congenital disorders, clogged kidneys or ureters, the ureter gossip, horseshoe kidney, vesicoureteral reflux, a congenital disorder that leads to the fusion of the kidneys from the bottom in the baby before birth, is a rare disorder. Surgical procedure in one part of the gastrointestinal tract, such as gastric bypass surgery. Sex, as men are more likely to develop kidney stones than women. Use certain medications such as diuretics and some types of antacids that contain calcium. Spongy kidneys are represented by a disorder of the kidney cysts in the area of the university canals and various kidney tubes, which is a rare disorder. Polycystic kidney disease is the growth of kidney cysts that gradually increase in size, leading to pressure on kidney tissue and kidney function disorder, a rare and often hereditary disorder. Diagnosis of kidney stones. Many cases of non-symptomatic kidney stones are diagnosed only by accident when performing an imaging test, such as X-rays to diagnose a health problem in the abdominal area, but if the stones are accompanied by symptoms, a number of different diagnostic tests may be used. Some of them are said to be urinalysis. Urinalysis helps detect blood in the urine, detect fragments of gravel for analysis, detect a type of urinary tract infection, and high proportions of elements such as calcium. Blood analysis. A high percentage of some elements that lead to a high risk of stones such as calcium in the blood, which in turn helps to determine the appropriate treatment, in addition to the fact that blood analysis helps to detect kidney function. For imaging tests, he uses some imaging tests, such as CT scans. Ultrasound imaging. In the case of sudden pain in the abdomen or side, or if blood is observed with urine, these tests help determine the location and size of kidney stones. It should be noted that it is preferable to use CT imaging in emergencies due to the speed and accuracy of the diagnosis, as this type of imaging is preferred in adults, as for children under 16 years of age ultrasound to detect gravel, and may resort to the use of CT imaging in some cases, as for pregnant women, ultrasound scans are performed. The treatment of kidney stones depends on the treatment of kidney stones on a number of different factors, as many stones can be disposed of without resorting to any treatment, and factors that may affect the chance of gravel coming out alone without treatment. The size, shape, location, and anatomical differences between people, and the size of gravel is one of the most important factors, as the rate of discharge of gravel not exceeding 4 mm without treatment reaches 80%. And for gravel more than 80 mm, her untreated discharge rate drops to as much as 20%, and some kidney stones treatments are shown according to the size of the stones and the associated symptoms. Small pebbles. Most cases of small kidney stones with mild symptoms can be treated through a number of simple procedures, some of which are indicated. Drinking fluids. Be careful to drink large amounts of fluid up to 2.8 liters per day to help the kidneys get gravel out. Pharmacological treatments. Your doctor prescribes some pharmacological treatments, such as alpha receptor blockers. That helps the gravel get out of the kidneys, by contributing to the relaxation of the ureter's muscles. Painkillers. Use of painkillers to relieve pain caused by the passage of gravel from the urinary tract, such as ibuprofen and paracetamol and naproxen. Big pebbles. In many cases, large stones cannot get out of the kidneys without medical intervention, in addition to some small cases of gravel as well, in which case some processes can be used to help break up and dispose of gravel, including what comes. Ureter binoculars. In this case, a special medical scope is used that passes through the urethra and bladder to the ureter and kidneys, and then the doctor removes or disintegrates the gravel after locating it, and the operation of the ureter stoop is a common treatment method used to get rid of kidney stones, especially in cases of blockage of the ureter, and in cases of small stones in the kidneys. Breakup of gravel by shock waves. This type of operation is used in cases of large gravel not more than 1 centimeter in size, and is not an effective way to break up larger pebbles, and the principle of the work of this technique is to direct shock waves on the skin over the area of the presence of gravel in the kidneys, which in turn leads to the fragmentation into small parts that can be disposed of through the urine. Transdermal kidney stones break up. The process of breaking up kidney stones is done through the skin. Insert a microspecimen through the back to the area of kidney stones to get rid of them, and this type of operation is used to get rid of large gravel, and gravel that does not respond to the shock wave gravel fragmentation process. Tips for kidney stones and how to prevent them. A history of pre-kidney stones increases your risk of developing kidney stones in the future, so the doctor performs a number of medical tests to detect the possibility of a health problem that increases the risk of kidney countlessness again, including analysis of gravel after removal. The doctor analyzes the gravel after removing it to detect its type, so it is recommended to save the gravel if it is observed to come out with urine as well. Urinalysis. In this case, urine samples are collected during the whole day. Other tests. There are a range of other tests that are performed to help detect a health problem that may be responsible for kidney stones, such as imaging tests and various blood tests. Methods of prevention of kidney stones depend on the results of the tests performed and the health problem that may be responsible for the formation of gravel in the infected person, and from the advice your doctor may give to help prevent the formation of gravel again can be mentioned as follows. Drinking liquids. The importance of eating sufficient amounts of fluids on a daily basis lies in the dissolving of substances that contribute to the formation of stones, and increased urine flow in the urinary system and kidneys, which in turn helps to prevent the formation of gravel. It should be noted that it is necessary to avoid eating large amounts of sweetened juices and sports drinks, because of their negative effects may lead to a higher risk of kidney stones. Preventive medicines. Your doctor may prescribe a medication based on the type of gravel suffered by the patient, which helps prevent the formation of this type of gravel again, such as prescribing antibiotics. In case of suffering from strovite grit, potassium citrate medication. To prevent some other types of gravel, in addition to many other medications that depend on the condition of the infected person, it should be noted that you should see a doctor before using one of these medications because they may have undesirable side effects. Diet. Your doctor may order some changes to the diet to help prevent the formation of gravel, depending on the type of gravel suffered by the person and the result of urine analysis, and your doctor may recommend some changes to the proportions of certain elements in diets, such as calcium, animal proteins, oxalate, and sodium, and it should be noted that getting proper amounts of calcium to help prevent an increase in the proportion of other elements that may be responsible for the formation of gravel. Special cases. Kidney stones may be caused by a health problem, such as hyperthyroidism, which causes a significant increase in calcium in the blood, in which case a surgical procedure can be performed to remove the thyroid glands to help prevent the formation of kidney stones. Doctor's review. Be careful to check the gut if one of the symptoms mentioned earlier that may indicate a type of kidney stones, in addition to some of these symptoms may indicate some serious health problems as well, such as appendicitis. It is also recommended to review medical emergencies in case of fever as well as gravel pain, which may indicate urinary tract infection and a high risk of sepsis. Complications of kidney stones. The infected person suffers from some serious health complications in some rare cases where kidney stones are not treated, as stones may lead to blockage or narrowing of the urethra, which in turn leads to increased effort on the kidneys as a result of urine collection, and an increased risk of urinary tract infection. Here are some other health complications that may accompany kidney stones in rare cases. Kidney scarring and damage, which in turn may lead to kidney failure. Severe infections that may be life-threatening, such as sepsis. Loss of function of one of the kidneys, which may lead to the need for a removal of the affected kidney. Clogged bladder, which in turn may lead to pain caused by urinary infarling.